Welcome, everyone, to the Reconnect Health Center podcast. We've got a special treat for you today. Given that it is October and it is Breast Cancer Awareness Month, we have Jenn Roy, who is a massage therapist, but also is a specialist in working with people who have lymphedema. Do you want to give us your whole title, Jenn, maybe on what you're actually, what do people call you?
So usually like an MLD therapist, so manual lymphatic drainage, or CDT, so complex decongestive therapist would, I
That
guess,
is
be
a
the
mouthful.
proper.
That's a
It
mouthful.
is.
Well, thank you for joining us today. We're super jazzed to have you. And we're so lucky to have you in our community working with patients who are recovering from lymphedema. Now, Jenn Roy is based out of our Fredericton clinic, but she does come up to our Moncton office once a month or once every 6 weeks to host a lymphedema clinic. So she's trying to spread herself out to help as many patients as possible, which is difficult for her, and we're very grateful for that. So Jenn, why don't you start by just telling me, like, what is lymphedema and why does it happen in breast cancer patients?
Yeah, so lymphedema is essentially something that happens when part of your lymphatic system is not working or missing. So there are situations where people can be born with a non-intact lymphatic system. So lymph vessels haven't fully developed. You're born missing a lymph node. So you can be born with what's called primary lymphedema. In terms of cancer, and in this case specifically breast cancer, lymphedema can happen when your lymph system becomes unintact. So with most types of cancer, but with breast cancer specifically, normally the surgeons will take one or multiple lymph nodes from the affected area, usually to biopsy whether the cancer is spreading to the lymphatic system or making sure that the surrounding tissue is healthy. The downside to that is as soon as you're missing one lymph node from anywhere in your body, you no longer have an intact lymphatic system, and you're at about a 67% increased risk of developing lymphedema. In my experience with being a CDT therapist is a lot of surgeons and oncologists are great about explaining the side effect of this, that you now have a higher risk and some of the precautions to look out for. But when it comes to cancer, the biggest thing is treating and curing the cancer. So some of those secondary things kind of go out the window, and people are just not informed or not aware of what to look out for. So something can happen, and then all of a sudden lymphedema is triggered throughout the body where the lymph node is missing.
Okay, I'm going to ask you some questions about that because that was a lot of information.
That was.
Can you, and you do a really good job explaining it, what's the lymphatic system?
So your lymphatic system it's this whole system that circulates through your body. It's actually very tied to your immune system. So the way I kind of explain it to my patients is if you think about it like your cardiovascular system. So you have lymph fluid, which is a combination of just different fluid throughout your body that's traveling through your body just at a much slower pace. So it takes about 30 minutes for one pulse, so one full circulation to go through your body. When everything is working cohesively, so you have all your lymph nodes, you have all your lymph vessels, everything like that, there's no disruptions to the system, and everything does what it's supposed to. When you are missing a part, so whether lymphatic vessels have been compromised or you're missing a lymph node, this fluid will still circulate the way it's supposed to, but it gets to this compromised area and it's kind of like, we don't quite know what to do anymore. Because you're missing a small or multiple small pieces of this big system that's kind of, I guess for lack of a better description, breaking the ecosystem of your lymphatic system, and then smaller breakdowns start happening and your body just doesn't know what to do, and you end up with an accumulation of fluid in the area. The biggest example in terms of breast cancer is it will stop flowing through, or not flow as effectively through, your armpit area, which is where you have a big bundle of lymph nodes. And that's why you see some people that have gone through breast cancer that have a larger arm. There's too much fluid in that area and it doesn't have the same capabilities to filter and circulate like it does in other areas of the body, or like it did prior to having the lymph node removed.
Okay, so let me make sure that I've got this straight. So the lymph system is like, if someone's picturing it, it's similar to like the circulatory system.
Yeah.
And that there's these vessels, and there's fluid, like what people would traditionally think of as swelling, like that type of fluid is flushed through their system.
Yes.
And then during a breast cancer surgery, if someone has had a lymph node removed, or if there's damage to those vessels, then swelling kind of gets trapped in certain areas.
Pretty much. I guess that's, the easiest way to explain.
Okay. And then, so what does and that would be what's called secondary lymphedema. You said when someone's not born with it, when it's caused because of a condition or a surgery, it's secondary lymphedema.
Yes. So secondary lymphedema is lymphedema that's triggered in your body as a result of something else happening. So in this case, it's secondary to a cancer treatment. It can be secondary to an injury or illness. So it's something that's happening as a result of something else major in your body.
Okay. And so what does that look like? You said it can look like that someone would have like a larger arm. Like how much larger are we talking about? What's the patient feeling? Like how would they identify that this is happening to them?
There are different stages of lymphedema. So you have 0 to stage 4. So typically in like that 0 stage, early on stage, people might find like, oh, my arm's getting a little swollen, my clothes fit differently around the shoulder. And that can progress into this tissue of your upper arm or your whole arm, in most cases, will start feeling harder. It can feel like you're wearing a t-shirt that's too tight. They'll start being restricted of range of motion because there's so much pressure accumulating underneath the surface of the skin where the lymph vessels are, that it's essentially that like things are getting too tight and things are getting larger. In different stages of lymphedema can determine how large the limb becomes. So in extreme situations, the arm can double or triple in size sometimes. It's alarming, and it's heartbreaking to see anybody go through that at the same time too. And when that starts happening, you start getting skin changes and stuff like that as well. So now the process of treating becomes more complicated because there's other factors at play as well. It's not just a little bit of extra swelling that your body doesn't know what to do with.
Okay, I've got more questions for you. So you were saying that it can be like part of the arm or the whole arm. So for me in the summer, when my hands swell, I feel it in my fingers, right? So like the distal ends of my limbs, this is where I'm getting it. Is that how it starts in lymphedema too? Or can it start, like, does it start at the armpit and work its way down? Or does it start at the fingers? Like, where are they going to feel things first?
It can go either way. It can happen in either direction. Typically, for most people that I've treated that are coming in for lymphedema due to breast cancer, it's usually starting in the upper arm and armpit area. That's where it's becoming overloaded because it's traveling up your arm. Fluid is traveling from your fingers towards your armpit to circulate through the whole body. So as it reaches the armpit, that's where it's starting to kind of accumulate because it doesn't want to move. Typically with lymphedema, it kind of starts at the most proximal area to the injury or the dissection site, and then will kind of travel down the arm from there.
Okay. And then it can get quite large in size, you said.
Yes.
So what do you do? Because you're a registered massage therapist and you've had to go on to do additional training to become certified in manual lymphatic drainage.
Yes.
What does a treatment look like? Like, how are you helping?
So typically a treatment, it depends on the area and what's going on. So if anybody that's had breast cancer, so one side, whether they've had a lumpectomy, partial or double mastectomy, we're always working on the affected side. So the good news in terms of lymphedema is it doesn't usually target both sides. It's pretty unilateral. So what the treatment consists of is working around the neck to start. There's different sequences for every area of the body, but the main point of drainage for your entire lymphatic system is just behind your collarbone. So we want to stimulate and utilize everything that's working in your lymphatic system. Just because one area is not working or has been disrupted doesn't mean that it's necessarily affecting your whole body in terms of the lymphatic system. So if it's the left arm, for example, we treat around the right breast, around the right armpit to really open up those areas. And then we work through the left arm and basically redirect fluid away from the armpit. So the nice thing with the lymphatic system is if you think about your body kind of like oceans and rivers, is you have the main ocean and then there's branches of rivers streaming off, and you can kind of redirect into an already existing river to take away from where a blockage is, if that analogy makes sense. So with the arm, for example, we want to move as much fluid away from the armpit as possible and utilize other lymph node areas and healthy lymph vessels that are working to get that fluid out of the congested area. And then from there, there's things like bandaging and compression that goes along with it.
Okay, so you're almost starting at the places that don't necessarily have an issue because you're trying to clear them out so that you can then push the lymphatic fluid that's backed up into those cleared out areas.
Yes.
Got it.
And into those cleared out areas. Yes. Sorry.
That's good. That's good. Okay. So what makes you different than any other massage therapist that's just like doing massage in that area? How is lymphatic massage different than just standard massage?
So lymphatic massage is one, it's very gentle. For starters, it is more of a skin technique. And one of the most common questions I get asked for whatever I'm doing MLD for is this even doing anything? There's no oil involved. It is very light. You do have lymphatic tissues in through your muscle, but for the most part, the vessels are very superficial to the surface of your skin. So in terms of manual lymphatic drainage versus general Swedish massage, for example, it's the tissue depth that you're working into, and you're only working with this one system without necessarily getting into like fascial tissue and muscle tissue and stuff like that. So it is a lot more gentle.
So you're not pushing as hard is basically what you're saying.
Basically.
And if you push too hard, my understanding is if you push too hard, you're actually kind of like collapsing the vessels and you can't actually even move the fluid. Like you have to go light enough that you're almost like just like coaxing the fluid, the swelling or the edema out of that body.
So there is a little bit of a misconception sometimes with the amount of pressure. So yes, it is light and you don't want to use a lot of pressure in an area because you can, for lack of a better description, collapse the lymph vessels, which always sounds more dramatic when you're saying it than what it actually is. But it also depends on the stage of lymphedema and what else is going on. If there's a lot of hardening in the tissue or in the limb itself, there needs to be a little bit more pressure to be able to move the skin. So one thing is I'm always checking the tissue health and how things are moving before we even start the treatment, because that's going to help determine the pressure sometimes too. It's still not going to be as much pressure as traditional Swedish massage, but I might have to go a little harder into the surface of the skin to be able to get everything to move properly.
Okay, so what do those skin changes look like?
So some of those skin changes, it can be flakiness of the skin, so keratosis, because there's so much extra fluid and pressure built underneath the skin that healthy nutrients can't get to the skin that it needs to stay healthy. So there can be flakiness, reddening of the skin. There can almost be, when there's a lot of pressure, the skin can almost look really shiny in a way. There's no nice way to describe anything lymphatic. So when I'm checking for tissue health, a lot of things are like the skin or the tissue under it will kind of feel like boggy or like there's been jelly injected underneath your skin in early stages. But reddening of the skin, the flakiness, things like that, discoloration, those are signs that your skin is changing in an area affected by lymphedema because there's too much pressure built up underneath the skin that it's not getting essentially the healthy nutrients that it needs.
Okay. And I was checking out your social media because you mentioned that sometimes you're working so lightly and then sometimes patients are like, is this even doing anything? And you do a very extensive like exam and you're taking objective measures. Like you're taking measurements so that you can see the benefits that are happening from the beginning of treatment toward like after, I don't know, do you get benefits in one treatment session? Is it numerous sessions?
Sometimes, and it depends on the person and kind of how far advanced things are. So yes, another question I get asked a lot too is like, why is this appointment so long? And so with an initial lymphatic treatment, especially in cases of lymphedema, the health history and the intake part I've had it take almost 50 minutes sometimes because there is a lot of complex health stuff going into it, but also the assessment of it. So absolutely, we measure the affected area on the first treatment for sure. That gives me kind of a baseline on the size and, or I guess, circumference of the area. There are some people that notice a difference within 1 or 2 treatments, and it depends on a lot of different aspects through the body and also what stage of lymphedema we're dealing with. one thing I always remind my patients of is you're the last person to notice change in yourself. So you can look in the mirror every day and be like, oh, nothing's changing. This isn't getting like any better. And this is one reason why we measure, because those numbers don't tend to lie, and we're measuring at the same points every time. So it's 4 centimeter increments up the entire leg or arm, whatever we're working on. And those numbers will start coming down. So that's a good sign that your lymphatic system's doing what it's supposed to in terms of redirecting to another healthy area, and that your limb is getting back to a quote unquote normal size.
So you're just using a tape measure, checking the circumference. Is that what it is? Every 4 centimeters up the arm?
Tape measure and eyeliner. We get that high tech.
The eyeliner to market?
Eyeliner to market.
Awesome. That's awesome. Okay. So is this something that you need to continue? Because this is, my understanding is this is a chronic illness. Do you need to keep continuing the treatments? Or is it something that people will independently manage?
So it's kind of a fine line between the two. So one thing with lymphedema is, unfortunately, once you have it, it is it's a lifelong medical condition. It is manageable. However, in terms of compression and treatment, it's something that has to be managed over the course of your life to prevent things from getting worse. But the treatment schedule does change. So in the initial treatment phase, usually there are a lot more treatments fairly close together. One nice thing with lymphatic treatments is you can do them one day right after the other. It's not going to hurt anything because we're not getting deep into muscle tissue. And doing those closer together treatments kind of like jumpstarts your body and gives it more of a chance to move in a way we want it to. The goal is to get it down to kind of a lymphedema maintenance schedule. And that can vary from person to person, especially if my patient has gotten into compression, which is something I recommend a lot to help manage the lymphedema as well. So treatments can go from multiple times a week to then starting to space them out. So we might need one treatment every week to a couple treatments every other week. And the goal essentially, depending on the person and how your body responds to the lymphatic treatment, is usually one treatment like every month or two as kind of like a maintenance thing, or lymphedema management. And that way I always say to people too, if we're kind of managing and keeping on top of it, if something happens, so humid weather is nobody's friend when they have lymphedema. So kind of for the summer months, we might need to amp up those treatments because the humidity is higher to keep the fluid down. But over the winter months, we might not need as many. So it's kind of situational in that case, but it's not something that you necessarily need to every 2 weeks until the end of time.
Oh, that's good to know. Okay. Because I'm sure that could feel kind of overwhelming to patients.
It absolutely can. And typically, and I always say this to my patients too, typically the treatment protocol is like 21 treatments in about 25 days. And in all fairness, that is not feasible for a practitioner, especially in an area where there are only 2 lymphedema therapists, for people's schedules either. And financially, that is a huge burden for anybody. At the end of the day, lymphedema coverage is coming out of massage benefits if you have them. So I always will work within whatever's comfortable for people. So, yes, that is what's recommended. That is not really feasible for a lot of people, and myself included. I'm only one person and I would be seeing a lot less patients. So there are ways around it, even for some people that they might only be able to come once a month. That's fine. We can still manage your lymphedema. It might take a couple extra treatments, but you're still going to get the help that you need.
Okay. So you can tailor the program to time constraints and financial restrictions and just your access to practitioners as well.
Absolutely. At the end of the day, for me, it's more important that regardless of what I'm treating, but especially for lymphedema, because I have seen it's heartbreaking for anybody that has it, anybody that's suffering with it, because at the end of the day, there's not a lot of help for it. I will never leave anybody to suffer. I will work within my patient schedules to make sure that, we can get some treatment with whatever works best for the both of us.
Okay, you've mentioned compression now for a while, a couple of times. Can you explain what you're talking about?
Yeah, so compression, in terms of the arm, you can get these super fancy compression sleeves. Nobody likes wearing them, but they are your best friend. If you have
so these are garments that people are wearing.
It's a garment, yes. So there's custom made and over the counter compression. So custom made is the measurements are all taken and done to your specifications, and it is something that is custom made to fit your limb at that time. There's also measurements and some great over the counter options for anybody that can't necessarily afford custom compression. One takeaway I had from a lymphedema conference that I went to, and this hit the nail on the head, is having lymphedema. It's a rich person's medical condition. And I wholeheartedly agree with that. Between treatments, compression can run hundreds of thousands of dollars, depending on what you need and how much you need. And again, not everybody has that. So I will also provide people with great over-the-counter options. Amazon has fantastic options for compression. Is it as great as custom? No. Is it still going to get the job done? Yes. Might not be in the same way, but it'll at least help stabilize. So it's essentially a sleeve or garment that helps balance out the internal pressure with the outside pressure of the limb to keep lymphatic fluid moving between treatments.
So it's kind of like how athletes wear like compression tights and compression socks. Like it's similar to that. My understanding is that it helps to kind of keep the edema from coming back into the limb between treatment sessions. Is that the case?
Yes. So it's essentially helping to stabilize and prevent the edema from kind of expanding and evenly dispersing that pressure up the limb to help keep things moving. So very similar to like athletic compression as well. Medical grade compression in terms of lymphedema usually just tends to be a higher compression level than what you're going to get in like a compression pant, but not so high that it's going to cause excess damage to the area.
Okay, so is it something that they're expected to wear all the time? Like in between seeing you, they've got the compression garments all the time? Is it just as needed?
So it is an all the time thing. So, 8 in the morning till 5 o'clock at night, wearing compression. You can also get nighttime compression as well, which is a different type of sleeve specifically designed to wear at night. So most kind of general compression sleeves, whether it is custom made or over the counter, they're not designed to wear 24/7. So you want to be using it when you're active, because that activity is going to help keep things moving with the balanced out compression. And when you're sleeping, you're obviously not moving around as much. So it's a different type of compression that still helps to stabilize and balance out the pressure, but is more for like an immobilized setting. Typically day-to-day compression, it's, I usually say like when you're going to be most active, but under the guidelines of like, an 8 to 5 kind of time frame. And then you can take it off to let your skin kind of relax and breathe. And then if you do have night compression, you have your night compression for when you go to bed.
That's amazing. So you mentioned there's not very many manual lymphatic drainage specialists in the New Brunswick region. How do people get a hold of you if they do want an appointment, and like how would they go about doing that?
So if you are ever wondering about a lymphatic therapist, specifically with the Vauders School of Canada, which is who I did my training through, you can actually go to their website, www.vauderschool.com, and you can search for a lymphedema therapist in your area. Anybody that has up-to-date certification will be listed right on that website, and you can search by province or anywhere in the world. There are 5 schools total that do the specialized training. I can't for the life of me remember the names of all of them.
We won't ask you to. That's okay.
Yeah, perfect. No trick questions. But you can go to one of the training schools' web pages and you can find anybody that is fully certified in the area. One thing I will say, just from a kind of safety standpoint, is as a massage therapist, we all learn basic lymphatic drainage in school. The difference between lymphatic drainage and manual lymphatic drainage, which is what I do, is the advanced training and knowing the precautions that you're working with in terms of complex medical conditions. So what we learn on a school level is not going to necessarily help and can cause further harm to somebody that does have lymphedema due to missing lymph nodes or damaged lymph vessels. So one of my big takeaways, and I always kind of remind people, is never going to tell you who to go see, but if it is for a lymphedema related case or like something involving your lymphatic system, if it's a complex medical issue, make sure you're seeking out somebody that at least has the advanced training in it.
Excellent. That's really good to know who you should be seeing, who you shouldn't be seeing. And if you are looking for Jenn herself, you can find her at Reconnect Health Center in Fredericton. You can go to www.reconnecthealth.ca, and that will bring you to some information. We will be posting this interview in its entirety on our YouTube channel, and you will be seeing some of these little minute clips of our discussion on our social media. But I wanted to take this time to thank you so much, Jenn, for your time in explaining lymphedema and what you do and how you're helping our patients, and to thank you so much for all of the hours that you put in with teaching and with patient care. I know that everybody is very, very appreciative of having access to your expertise.
Thank you.
All right, we'll talk to you later, okay?
All right. Bye.
Okay, bye.